let's talk about a story that should stop every one of us in our tracks. A new global report has just been released, and its findings are stark, sobering, and deeply unsettling. Cancer cases are rising, cancer deaths are rising, not falling, not stabilizing, rising. In an era of breathtaking medical advances, of billion-dollar pharmaceutical breakthroughs, of cutting-edge technology, the one disease that has haunted humanity for centuries is not receding, it is advancing. And the question that has to be asked is why? Why, with all the resources we have poured into cancer research, with all the awareness campaigns, with all the pink ribbons, the charity runs, the fundraising drives, why is the problem still getting worse? According to this report, millions of new cancer cases are being diagnosed each year. Millions of lives are being lost, and the trajectory is not leveling off. By 2050, the numbers could be staggering. And yet, somehow, we are not treating this like the crisis it is. We talk about climate change, about wars, about economic downturns, and rightly so, but cancer continues to silently devastate families in every country on every continent. It's not headline news every night, but maybe it should be, because think about it, cancer is not just one disease, it's hundreds of diseases striking rich and poor, young and old, men and women. It does not discriminate. And yet, the resources to fight it are distributed with shocking inequality. If you live in a high-income country, you may have access to early screening, advanced treatments, world-class oncologists. But if you live in a low-income country, or even in an underserved community within a wealthy nation, your chances of survival plummet. That's not biology, that's politics, that's economics, that's policy failure. And the report makes this clear. The gap between rich and poor in cancer outcomes is not narrowing, it's widening. In some parts of the world, basic screening for breast or cervical cancer, screening that can literally save lives by catching disease early, is still unavailable to millions of women. In other regions, life-saving drugs are priced out of reach, monopolized by pharmaceutical companies who claim the costs of innovation justify the staggering prices. But tell me, what price would you put on a life, and why is it that profits always seem to outweigh patients? At the same time, lifestyle factors are driving cancer rates up. Tobacco use, alcohol consumption, unhealthy diets, obesity, environmental pollution, all of them are contributing to rising cases. We know this. The science is clear, and yet industries that profit from these very habits are rarely held accountable. Where is the outrage when fast food giants, alcohol companies, and tobacco corporations profit while cancer spreads? Where is the urgency in regulating the chemicals we breathe, the toxins we consume, the pollutants in our water and air? This report should be a wake-up call. But the truth is, we've had many wake-up calls before. Reports like this have come and gone. Numbers have been projected, trends have been charted, but little has changed, which begs the question, how many more millions of lives must be lost before we treat cancer not just as a personal tragedy, not just as a medical challenge, but as the political, economic, and social emergency that it is? We cannot ignore the fact that cancer has become a mirror, reflecting the inequality, the greed, the negligence that defines so much of our modern world. Let's take a closer look. In high-income countries, survival rates for breast cancer or childhood leukemia have improved significantly over the last few decades. But in low and middle-income countries, where the majority of the world's population lives, survival rates remain abysmally low. That's not because the cancer is somehow stronger there. It's because access to care is weaker, infrastructure is weaker, and resources are scarcer. Imagine a child in New York or London with leukemia. That child has a real chance. Now imagine a child in rural Africa or South Asia with the same diagnosis. The difference between life and death is not medicine, it is geography, it is poverty, and then there is the issue of cost. The cost of cancer treatment is bankrupting families, even in wealthy nations. In the United States, Patients are forced to choose between life-saving drugs and financial ruin. A single round of treatment can run into the tens of thousands of dollars. Some drugs cost hundreds of thousands a year. And what is the response from pharmaceutical companies? Record profits. Executives pocketing millions. Stock prices soaring. Meanwhile, patients sell their homes, drain their savings, or worse, go without treatment altogether. In what kind of society do we allow corporations to profit from the desperation of the sick? The report also highlights the rise in preventable cancers, preventable meaning they didn't have to happen. Lung cancer caused by tobacco, liver cancer fueled by alcohol, colon cancer linked to diet and obesity, skin cancer from excessive sun exposure without protection. We know the causes, we know the risks, and yet prevention remains underfunded and underprioritized. Why? Because prevention doesn't make money. Treatment does. You can sell drugs, chemotherapy, radiation, surgery. You can't sell people on not smoking, not drinking, or eating healthier without clashing with powerful industries. And let's not ignore the role of governments. Too often, they bow to lobbyists rather than listen to doctors. Tobacco companies fight tooth and nail against plain packaging laws. Food giants lobby against sugar taxes. Alcohol corporations market aggressively to young people, and politicians reliant on donations cave in. So while cancer cases rise, so too does the complicity of those in power. The report lays out the facts, but the facts raise a deeper moral question. How many of these deaths are not accidents of biology, but the predictable outcomes of political choices? Think also about the psychological toll. Cancer doesn't just kill, it terrifies. The very word sends shockwaves through families. A diagnosis is not just a medical event, it's an emotional earthquake. And when these cases are rising, so too is the anxiety, the dread, the trauma carried by millions of people around the world. The report statistics may seem cold, but behind every number is a story, a family, a child, a parent. These are not abstract figures. These are lives. And when the world shrugs at rising cancer cases and deaths, it is shrugging at human beings. Now, let's look at solutions, because the report doesn't only outline problems. It also points to where progress can and must be made. Early detection is key. Cancers caught early are far more likely to be treated successfully. And yet, millions lack access to even the most basic screening. This is unacceptable. Mammograms, pap smears, colonoscopies, simple blood tests, these are not luxuries, they should be standard, universal, and governments that fail to provide them are failing their citizens in the most fundamental way. The report also underscores the need for stronger health systems. You cannot fight cancer with broken infrastructure. You cannot save lives without trained oncologists, without functioning hospitals, without affordable medication. That requires investment. That requires political will. And here's the uncomfortable truth. Many governments claim they cannot afford it, but they somehow find trillions for wars, for defense, for corporate bailouts. So the money exists. The question is priorities. Do we value human life as much as we value military hardware? Do we put the health of our citizens above the profits of corporations? Then there is the issue of research. Tremendous progress has been made in understanding cancer at the molecular level. Immunotherapy, targeted therapy, precision medicine, these are breakthroughs that were unthinkable just a generation ago. But access to these cutting-edge treatments is limited to the wealthy few. Innovation without equity is injustice, and until every patient, regardless of income, can benefit from the science of today, we will remain a world of haves and have-nots, even in life and death. The report calls for prevention campaigns to be scaled up dramatically, anti-smoking measures, regulations on junk food marketing, cleaner air policies, education about healthy lifestyles. These are not glamorous solutions, but they are effective. The problem is they threaten industries that wield enormous power. And so prevention remains the neglected stepchild of the global health conversation. But let me be blunt, without prevention, no amount of treatment will ever keep pace. If we don't stop cancer before it starts, we will drown in cases that we cannot possibly treat. We must also talk about global solidarity. Cancer is not a problem that respects borders. No country can fight it alone. International cooperation is essential in sharing research, in distributing medicines, in building health systems. Yet, just as with climate change, nationalism and selfishness dominate. Rich countries hoard drugs, poor countries beg, lives hang in the balance while leaders argue. And this is perhaps the greatest indictment of all that in a world as interconnected as ours, we still treat human life as though it has a passport, a nationality, a price tag. So yes, the report is alarming. Yes, the statistics are grim, but they also present us with a choice. We can continue as we are, watching the numbers rise, shrugging our shoulders, pretending there's nothing to be done, or we can confront the uncomfortable truths, challenge the powerful interests, and finally treat cancer like the global emergency it truly is, which brings us to the final unavoidable point: responsibility. Whose responsibility is it to act? Governments, certainly. They must legislate, regulate, fund, and enforce, but also corporations, pharmaceutical companies must make life-saving drugs affordable. Food, alcohol, and tobacco giants must be held accountable for the harm their products cause. Media must stop trivializing the issue, stop normalizing unhealthy lifestyles, and start amplifying the urgency of prevention. And yes, individuals too must take responsibility for their own choices, for their own health where they can. But let us be clear, individual choices alone will not solve a systemic crisis. You can't yoga your way out of polluted air. You can't kale smoothie your way out of poverty. This requires collective action. The report makes it undeniable: if current trends continue, the human and economic cost of cancer will be devastating, not just in hospitals, but in households, in workplaces, in entire economies. Millions of families driven into poverty, billions drained from productivity. And the cruel irony is that many of these costs are preventable if only we act. But here's the catch: action requires courage, courage to stand up to corporate power, courage to prioritize health over profit, courage to make long-term investments that may not yield immediate political gains. And so the question hangs in the air: do we have that courage? Do our leaders? Do we, as citizens, demand it from them? Or do we accept a world where cancer cases rise, where deaths climb, where suffering spreads unchecked? This report is not destiny, it is a warning, but warnings only matter if we listen. In the end, this is not just about numbers on a page, it is about lives, it is about dignity, it is about justice. Cancer has been called the great equalizer, but in reality, it is the great divider between rich and poor, between those with access and those without, between those who live and those who die. That divide is not written in our DNA. It is written in our policies, in our priorities, in our politics, and it can be rewritten. So as we digest the findings of this report, let's not just shake our heads in despair. Let's demand action. Let's demand equity. Let's demand a world where no child dies of a treatable cancer because her parents are poor, where no patient goes bankrupt trying to stay alive, where prevention is not an afterthought, but a foundation. Rising cancer cases and deaths are not inevitable. They are a choice. And the real question is, will we continue to choose indifference, or will we finally choose life? At the end of all of this, what this report forces us to confront is brutally simple: cancer cases are rising, cancer deaths are rising, and unless something changes, they will keep rising. That is not fate. That is not biology alone. That is the direct result of choices, choices by governments that fail to invest in healthcare, choices by corporations that put profits above people, choices by societies that tolerate inequality and call it normal. So the next time someone tells you cancer is inevitable, remember this: millions of cases are preventable, millions of lives can be saved. The science exists, the treatments exist, the knowledge exists. What is missing is the will, the courage, the urgency. And that, in the end, is the real cancer eating away at us: complacency. This report is not just another stack of statistics to be shelved and forgotten. It is a test of our values, of our priorities, of our humanity. Do we continue down the path of indifference, watching the numbers climb higher, watching families torn apart, watching suffering spread? Or do we act? Do we demand justice, demand equity, demand that health be treated not as a privilege for the wealthy, but as a right for all? The answer will not be written in a report. It will be written in what we do next. And history will judge us not by the speeches we give about cancer, not by the awareness campaigns we run, but by the lives we save or fail to save,